Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I have my lovely assistant Kaylin here. All right, so today we want to talk about all on four. Basically, when a patient is done with their all on four, they go home. You've seen this question a few times, right? Okay, so they go home and they have all their dental implants placed after the surgery. We convert their prosthesis. They smile and they see all their teeth, right? So over the years, we have had a few patients ask, "How come like we don't have a second molar on this tooth?"
Or can I add one?
Can we add another tooth? And if I smile, another thing to like keep in the equation is like when we have patients, when we're consulting with them, we have them smile as wide as we can. Do you know why we do that?
To see how far back their teeth are going.
Right. Yep. So everybody's musculature is different. Some people, as you know, like they smile really wide and you can see all their gums and like how gummy they are technically. And then not only that, but like how high their smile goes, but also how wide their smile goes. So some people like when they smile can smile very wide and that can almost see like literally up to like their second molar. So very far back there. But most people when they smile, they don't smile like smile real wide for me. Yeah. See, actually, with Kaylin, like she's got a beautiful smile, but if you look very closely to see like how far you can actually see, you can only see up to her second premolars, which is I think probably about average. But some people you could see to that first molar. Some like rarely you could see to the second molar. All right, why the hell am I talking about all this? Well, if you're investing all this time and money because you want, all on four because you want to be able to chew again, and also you want to be able to smile and smile wide without showing that you're missing teeth back there, then what we're going to be talking about in the next few minutes is basically what are the factors that come into play, meaning basically how many dental implants can we place? More importantly, where will we be placing those implants? And also, based off of that, like how many teeth we can place back there. Okay? All right, so let's get started here. So I'm going to use this as like a very crude example. I literally just downloaded this from the internet, but somebody took a panoramic x-ray. These are the implants that we're placing. And like what you can see is basically, all right, how many teeth are we hanging off of the back edge, right? So what we don't want to do is create a situation where, we literally have to think of this as like the pillars of support underneath like a bridge or like a highway overpass. You wouldn't want to place like an implant here and an implant here and have like a very large extension of teeth hanging off of it, because if you decided to choose something hard on your right side, what may happen is your prosthesis during a temporary phase may fracture off, or another thing that could be is just you'll continually get stresses on the implants, and I'll go over that a little bit later on. So keep in mind in this, this little presentation, I'm going to basically be going over like a very ideal situation. Kaylin, obviously when we do surgeries, I mean, you've assisted me, God knows like how many like, implant surgeries, what our expectations are, even though we have a 3D scan, versus what really happens is can
Not
be very
always,
different.
yeah.
Yeah, right? We know basically like, man, I've been practicing 11 years, placed like 10,000 implants. And like there are some cases where I say that it's going to be a really quick and easy all on four, and then my assistants get mad at me because they're like, "Oh,
He jinxes himself."
yeah, we jinx ourselves, right?" And like how are we basically jinxing ourselves is basically the bone consistency could be very soft, right? That could really throw us off, which can then also cause complications with our dental implant placements. Also, when we're taking teeth out, if the patient has their teeth, we know that if their teeth are very broken down, those infections and like in the bone, very big infections that can impede where we're going to place our implants. Ideally there are certain areas I want to place the implants, right? And so but what I'll try to be discussing in this example is like a very ideal case and why we do what we do. And I will create another video talking about what are all these other factors that come into play that really do make some all-on-4 cases more difficult. All right, so when it comes to all-on-4, how many implants are needed for all-on-4?
4.
Okay, cool. Have you ever seen me place more than 4?
Oh, yeah.
Okay. And do you know why typically? I know I don't like do surgeries and ask you, "Hey, Kaylin, do you know why I'm doing this?" Like,
I mean, I think it's a case-by-case basis. Sometimes you need that extra, insurance back there just in case one fails because you're a little unsure about one, or if the bone's a little bit softer or less dense. In certain areas, you may place an additional one just to add that extra support.
Okay, you nailed it, right? So basically, I am, having placed so many implants, basically I am like, very detail oriented with like what I do, but also you almost have to
Plan for the worst.
Plan for the worst, exactly. That's what we do. Like you see, like all the different surgeries that we do, right? So there can always be complications. So how do we always account for the worst? But anyways, like, to answer the question, how many implants we need for All-on-4? All
Usually
four.
four.
Right. That's why we call it All-on-4, right? But the thing is, like, so I tell patients this all the time. Think about like your upper jawbone is a lot softer than the lower jawbone, right? And so like the example I tell patients is this, like, All-on-4 when you're doing it, let's make the reality is it's an expensive procedure, right? I mean, but it's a great investment, but it does cost some money. Now, imagine we have the dry erase board on the wall. I mean, let's say it was like $10,000, right? So I don't want it falling crashing to the floor. So what I want to do is I want to drill into the studs, right? Like anything we all like expensive that we want to make sure it's not going to fall, we want to drill into studs. Why do we want to drill in the studs? Because it's more dense, right? So the nails are really going to be secured in there. Now let's imagine that I don't have studs in the wall and I just have the drywall. Then if that's the case, then I better put up as many damn screws as I can to be able to support my painting or whatever it is I'm hanging up. And so that's the same concept. Our upper jawbone is very soft compared to our lower jawbone. So our lower jawbone can technically get away with fewer implants. But also on the upper, you can have great success placing only 4 implants. But again, as we've seen, many patients, their bone consistency differs, right? Areas of infection, large sinuses, also the consistency of the bone that they do have. These are all different, very, very different variables.
Or how much bone they have.
Exactly, the thickness, right? The length of it, right? So obviously when we're doing All-on-4s too, like you always ask me, all right, like what size implant do you want here, right? So these are all based off of like different factors whenever we're doing on All-on-4. Let's take a step back. With traditional, excuse me, when talking about dental implants go through a process of what they call osseointegration, where the implant has to fuse to the bone. Okay, when we place that implant fresh, it's not fully secured to the bone, right? I like to tell people like waiting for a dental implant to heal to your bone is like waiting for concrete to set around a post. At that point, we know it's like really solid, right? And so for your lower jawbone, that typically takes about 3 months. For your upper jawbone, that typically takes about 4 months. And then also when we later load the implants, right? So we put the abutment and crown on top of that, right? So again, going to our example, we want to wait for the concrete to set before we start building on there. But, typically with single implants or implant bridges, you're going to have like, one implant, one crown sitting on one implant.
Taking all that force.
Right, taking all that force. Now, if you have an implant bridge, you'll have like maybe 3 teeth, maybe max 4 teeth on 2 implants, right? Like that would be like the max. Okay, but All-on-4 was like this really crazy radical concept because now we are taking minus the wisdom teeth, right? Most often 12 teeth or 14 teeth in a jaw and making them all rest only on 4 dental implants. Now the reason why the All-on-4 concept works is because obviously you see like the really long implants that we're placing, right? And they have a wider diameter too. So like, we're using like these longer, wider implants to be able to bear all those, the weight of the prosthesis. Now also when when I'm placing implants, I'm not just placing 4 it's not like the magic number's 4 and I'm placing them all in one area, right? We're trying to spread them out as wide as possible.
Evenly as possible.
Yep, as evenly as possible, as equidistant from each other as possible, right? So again, we want to kind of design almost like, imagine like here in Dallas Fort Worth, we see a lot of 11 years I've been living here, like tons of like construction. Imagine your big highway overpass. They want to prepare for a situation where they're going to have like as many semi trucks
on top as possible,
completely loaded, like all passing over the same part of the bridge at the same time, right? Just like prepare for the worst case scenario, and then the engineers had to figure out, okay, what depth, and what circumference, what size are these pillars to support the foundation, right? So literally the same concept, right? So we need to have a certain amount of spread that we have. I've seen examples where people place 4 dental implants all at the front here, and they're hanging the teeth way off back here, creating an excessive cantilever. I mean, that could be an issue because you're going to create a lot of force. There's people who love to chew just on one side, right? Or they may go home and chew on a jawbreaker or something, and even though you might use a stronger prosthesis like a zirconia prosthesis and it won't break, but if you're constantly chewing back there, you can create those excessive cantilevering forces which can cause that dental implant to fail, so. All right, so let me ask you a question, Kaylin. So We just established the fact that we're trying to place the implants as separated from each other. We're trying to get them as far back as possible too, right? To support for those molars. It's because where we're going to be chewing intensely. So our front teeth are for tearing into foods. Our back teeth are for like really chewing into the foods, and they take the most of the force, right? So like, does that mean I just place all my implants equidistant and go back as far as I can in the jaw?
No.
No, obviously. Okay, so upper jaw, what's my biggest obstacles?
Sinuses.
Sinuses, absolutely. And you've seen on every different patient, everybody has different size sinuses,
yeah.
right? Some of them go very far up front. Some of them are actually like nowhere to be seen. That's pretty rare. But the sinuses really affect where I'm placing my implants, right? Okay. So, yeah, that's definitely the case, right? So, like, when I'm looking at X-rays for a case, I'm always to, tell patients how easy a case is. I'm going to be, like, looking at those sinuses, number one. I was like, hopefully they're not placed too far anteriorly. Do we need, like, the remaining teeth? Do we have any infections, stuff like that? If they've been missing their teeth, like, how much bone resorption have they had over the years? If I need to get primary stability, there's something called pterygoid implants that I can use to get more stability also. Now, those are the uppers. The lower jaw, then, obviously, what's the biggest issue?
The, like, mandibular nerve, right?
Yes, inferior alveolar nerve. Yes. So, yeah, we don't want to drill into your nerve, right?
No.
So, basically, if you've been missing your teeth back there, how long have you been missing them? Because we know that you've been missing your teeth, you get more bone resorption, right? The more bone resorption you get, the closer we may be to the nerve. I don't have as much space.
Your bone gets, like, super tiny.
Yes. So then, like, not only in height, but also in width, right? So then that can affect what size implant that we were talking about. And a few minutes ago, I was talking about how big I want those implants to be able to support, that load when you're chewing down. But here's the great thing about your lower jaw is, like, your lower jaw is mandibular bone. So that's very dense, right? So the fact that it's very dense does help us get away with the fact that we can potentially use shorter implants, stuff like that. And we can also cantilever a little bit more. And I'm actually going to talk about that in a few minutes. All right, so quick little example of an X-ray for all-on-4. Sinus cavities. So they're staying away from drilling into the sinus cavities. I don't know why we're not looking at one of our own examples. I guess I'm too lazy to find an example right now. This is something I just downloaded real quick from the internet. But just what I wanted to point out is back up here, like, where this implant is, thankfully they were able to get an implant further back here to be able to support this first molar. But we don't see too much of a cantilever here, right, Kaylin? All right, that's really good. And that's what we don't want to see. We don't want to see excessive cantilever up here. Now look at this one. This one's got a way bigger cantilever down here. The reason is, again, this is where your nerve is. They don't want to drill into your nerve. And again, with the lower, like, your jaw is much stronger at the bone, and so provided your prosthesis can handle it, you can hang off all these teeth here. Okay, so. That's why we can have a longer cantilever here. Again, why we're worried about a cantilever is we don't want to make sure that your implants are going to fail or your prosthesis is going to break. So yeah, again, to sum it up, that's really like what we basically use to determine where we can place your implants. Again, rule number 1, I can't add teeth back further back here so you can chew, and when you smile that you can see those teeth. If I can't get an implant reasonably in an area underneath where the teeth are going to be, right? Especially for your upper jaw. Now, and that's even more specific because when we smile, we typically see the upper teeth, right? Like when someone's missing a teeth down low, like for example, a lower first molar, and you smile, most people can't see that. But for your upper first molar, on you, I wouldn't be able to see. But a second premolar, I would be able to see on you. But, if I don't have an implant reasonably within an area, like at least a tooth in front of it, then that's a problem. So for your upper teeth, again, that's an equation where basically, again, because of the softness of the bone, they say if like you got an implant here to the certain area, let's say the first premolar, you can add only one tooth behind it. Now, for your lower, we have an equation. They take basically the distance between your front implant and your back implant, and then they multiply that times 1.5, and that's the distance that you can hang further teeth back there. So I don't know if that really made sense, but long story short, you can hang teeth further back here for your lower jaw. So that's really to answer any questions in regards to like if anybody ever is to like if you want to be really knowledgeable heading into your consultation, that's really what you want to look at. You want to see basically look at your x-ray real quick. You'll be able to see your nerves. You can have your surgeon explain, hey, where are my nerves at? Where are my sinuses at? Okay, what are your expectations in regards to
placing the implants?
Placing the implants. Now, The other thing that we can do for that too that can kind of overcome that is again what I was talking about, pterygoid implants. So we can get supports way far back here so that you can hang as many dang teeth out of there on there as possible. And then the other thing too is like sinus lifting, but the problem with sinus lifting, as we know, is that there's a significant period of healing time. So that could kind of delay the process. So hopefully this information was very helpful for you guys, and if you guys could give us a thumbs up, we would greatly appreciate it. Give us a follow on our channel, and ask any questions you may want in the comments, and we'll definitely try our best to answer those. Thank you.